Hi everyone. So today we're talking about rheumatic fever. And what is rheumatic fever? Rheumatic fever is a childhood disease, and at one time rheumatic fever was the most common cause of death by disease in the United States. It's still a very common cause of disease in the world. So let's look at some things about rheumatic fever. Rheumatic fever usually is going to affect kids between the ages of 4 and 18 years old. Okay? The most common age for rheumatic fever to affect is in 10-year-olds. All right, so it's usually, as you can see, it's a childhood disease, but adults can get it too. It's usually caused by strep, the coxal, pyogenes. Okay, so it's caused by strep, and it can affect different areas of the body. So, like we said, at one time it was the most common cause of death. Actually, let me put it like this. Most common childhood disease to cause death. In fact, it was so common that rheumatic fever actually killed more children than all other childhood diseases combined. So let's take a look at this now. And here's what happens. So we said it's caused by streptococcal pyogenes. So if you recall, cocci or coxal means our bacteria is round shaped. So there I have my streptococci. In streptococci, it means it's in a chain-like pattern. Okay, so now there's my streptococci. On streptococci pyogenes, you have something called M proteins. They look kind of like spider legs coming off of here, and you can see why they call them M proteins, because they kind of look like an M. M proteins, they're an antigen. Okay, so M proteins they're an antigen, which means they are going to cause an immune response. So my white blood cells are going to see this, or my immune system is going to see this, and it's going to attack these. However, M proteins counteract the body's immune response. Okay, and part of the way they do this is they prevent phagocytosis. So the M proteins are actually going to make this resistant to phagocytosis. So M proteins make strep resistant to phagocytosis. And if you recall phagocytosis means cell eating, right? So what happens is my white blood cells will try to eat this, but the M proteins will actually help prevent that. One other thing about the M proteins is the M proteins are they help strep stick to tissues. Okay? And one of the most common tissues will be the tissues of the throat. So especially the throat. So now let's take a look at what actually happens now in rheumatic fever. So this is going to be my throat cells. And there's a nucleus, there's a nucleus. All right, these are my throat cells. And what will happen now is my strep with the M proteins will attach onto this. All right, and so what's going to happen when it attaches onto it, it's actually going to start to damage the tissues that are in here. Now, I'm not going to go into everything that happens what the tissues do, but just really quick, if you recall from my inflammatory video, when this happens, the cells will release something called arachidonic acid. The arachidonic acid will be converted into prostaglandins and into leukotrienes. The leukotrienes are then going to call white blood cells over, right? So What's going to happen now is I'm going to get some white blood cells coming over, and the most common ones are going to be my macrophages. So macrophages will come to the area. Okay, and my neutrophils. Okay, so neutrophils will also come to the area. And what these will do is they will actually attack this. What neutrophils will do when they attack this is they will actually break down the strep, and then what they'll do is, remember, the M proteins are an antigen. So here's my antigens, and then what the neutrophil will do is it will release these antigens into lymph tissue. And this is going to go over to a lymph node. All right? What the macrophages will do is they will also break this down, but eventually what they'll do is they'll make a receptor and they're going to take this over to the lymph node too. Macrophages work a little bit different. I don't want to get into it right now, but what they'll do is they'll make a little receptor on this, and then with that receptor, they'll present my M protein or my antigen. They'll do this inside the lymph node, and then my T cells will come over and it starts a reaction. The whole thing is we're going to end up with antibodies. So let's take a look at I'm just going to say this is my lymph node right here. All right, and now I got my macrophages coming in here and the antigens coming in here. And so eventually what's going to happen is, like I said, the lymph node, without going too much into this reaction, it's on the inflammatory video, but what will happen is my antibodies, I'll end up making antibodies, okay? So we will make antibodies to this, my B cells will. And my lymph node will eventually release these antibodies. Now here's how it works. Most of the time these antibodies are going to go up and they're going to attack my M cells that are on the strep. I know these don't look like M's, right? But they're going to go and attack this, right? I'm going to get more macrophages come to the area. I'm going to get more neutrophils coming to the area. And it's going to attack this, and that'll take care of the problem for the most part, in about 97% of people. But here's what happens to some people, is we release these antibodies, and you have proteins in other part of the body. So let's just say this is my skin right here, right? And there's my epidermis, and then I have my dermis. I have some hair coming out of this. And here's what's going to happen. It looks like a birthday cake. But here's what's going to happen is I also have proteins on here. Okay? These proteins are called keratin. Keratin is what makes your skin waterproof. So what's going to happen is these proteins look enough like these antigens. So what your antibodies think is that these proteins are actually bad guys. So what it will do is these antibodies will actually go over and start targeting these to be attacked by white blood cells. All right, and then you can end up with a rash. So one of the first signs one of the signs that I'm covering of rheumatic fever is you get a rash on the skin. Okay? The other thing it's going to do is your body will start producing collagen. Down here in the lower layers, it'll start producing collagen. All right, so it produces collagen. And if you notice, this is actually underneath, kind of underneath my skin. And you can actually see these. They'll usually be on extensive surfaces of the skin. And what'll happen is, they call these subcutaneous nodules when you can see them. So they're called subcutaneous. Subcutaneous means it's under the skin. Right? I'm just going to write right here. Subcutaneous nodules. Okay, so that's another sign of rheumatic fever. This is not that common, but it still occurs. The other thing about this is that these will go away. These will eventually go away. So that's one of the things that can happen in rheumatic fever. I get subcutaneous nodules and I get a rash. Now, the other thing it can do, especially on large joints, So let's say this is my hip joint right here. All right, and here's my hip joint, and there's my greater trochanter. Here's my pelvis part here, and this is going to go up like this, up the radial foramen. Okay, we're just drawing half of the pelvis here. All right, so another thing that can happen here is you have proteins. You have tissue that are around here, around the joint. All right, and then you have proteins that are in these tissues. And unfortunately, what can happen is, again, sometimes on some people, these proteins look close enough to the antigens up here. And so once again, what will happen is my antibodies will attack these, and they will make them look like the bad guy. By the way, because of the fact that my own body is attacking my own body now, right? My own immune system is attacking my own body. Rheumatic fever is considered an autoimmune disorder. Autoimmune disorders is when your own immune system attacks your own body. Like the more common ones is like systemic lupus or rheumatoid arthritis. Okay, so rheumatic fever is considered an autoimmune disorder. So now I have my antibodies attacking them. Now white blood cells are going to come over and they're going to attack that. So another sign of rheumatic fever is going to be polyarthralgia. Poly means many, right? Or polyarthritis, or because you get joint pain with it, I'll put polyarthralgia. Okay, so what's going to happen is I'm going to get painful joints around my body with rheumatoid arthritis. Okay, so that's the second symptom that we can have, or actually the third, because we have the rash on the skin, we can have subcutaneous nodules, I can get pain all over the body. Another thing that can happen is in the brain, you have a part of the brain inside the middle called the basal ganglia. And the basal ganglia, like other parts of the body, have proteins on them. The basal ganglia is responsible for basically when I make motions, my arms don't move too much. So they kind of limit the motion so I can get smooth movements, knowing when to stop and when to start. So on here again, I am going to have some type of proteins in there. And there's my basal ganglia. I should have drawn it a little bit more in the middle, so forgive me, that's not in the middle. But once again, I have proteins on here, and like we've been saying, my antibodies will attack this. And this can cause a condition called Sydenham's chorea. Right? So in Sydenham's chorea, what happens is there's uncontrollable movements of the arms and legs. Okay? This usually affects girls. So it usually affects girls. And the other thing about this is it usually goes away on its own. Okay? This can occur up to a few months after someone's actually had rheumatic fever. All right, so that's the next one. And then the last one is going to be the heart. So here's my heart. All right, there's my heart. And what's going to happen here is you have 3 layers to the heart. So the inside layer, one second, okay. So on the inside layer, we actually have some cells that are on here called endothelial cells. And what that is called is the epicardium. I'm sorry, the endocardium. All right. Then the next layer is going to be full of muscle, and that is going to be called, okay, I'm not going to draw the muscle going all the way around the heart, just imagine it does. But this is called the myocardium. Okay? And then on the outside, you have a last layer, which is called the epicardium. So it's the outermost layer. Here, rheumatoid or rheumatic fever can actually affect all three of these layers, okay? And if it does affect all three of these layers, we call it pancarditis. So anyways, on here we have something called a valve. And what the valves are responsible for, and it's over here also, I just drew it on that one side. What the valves are responsible for is they take blood in from the body or the lungs, and then it comes into this area here, and then when the top part of the heart beats, this opens up, and then the blood goes down into here. This is called the ventricles. And this happens on both sides. And then what will happen is the valve will close. So it opens up, blood comes in, the valve closes. Opens up, blood comes in, valve closes. And then the ventricle pumps the blood out to the body, the left ventricle. The right ventricle pumps it to the lungs. So once again, like the pattern we've been seeing, is you can actually have markers on here, and the proteins on here inside of the body, on the valves, and then your body will identify these as being bad guys and stick antibodies on them, and that will cause an immune response. And so what happens now is your immune system starts to destroy your valve. Now, rheumatic fever doesn't always destroy the valve. It can, and if it does, it leads to death. What rheumatic fever can also do is it can cause damage. Then a person gets better, but now these cells here are damaged. So my endocardial cells, my epithelial cells are now damaged. My valves could be damaged and no longer working properly. They could be prolapsing, so instead of closing nice and easy, they kind of like close like this now, right? So I have an opening there all the time, which it can lead to blood going back this way, which basically is what happens in a heart murmur. But now what can happen is I can get other bacteria. Let's say I go to the dentist and I get, well, eventually what's going to happen is we're going to build up scabs on here. And then let's say I go to the dentist, and when I'm at the dentist, I get a tooth extraction. And strep, now another form of strep, can actually get into the body and attach onto these scabs here, right? And cause a condition called subacute bacterial endocarditis, which can also kill you. All right, so as you can see, rheumatic fever affects a lot of the body. A lot of times, most of the stuff goes away with no problem, but in a small percentage of people, it does cause problems. Anyways, that's it for rheumatic fever, and thank you for watching.